Good afternoon, class. This is Roxana Branes, a papillary thyroid cancer survivor. I will be asking her a couple of questions so she can give us an insight of what it is to have or have had thyroid cancer. Ms. Branes, please state your name for the records and your profession.
Good afternoon. My name is Roxana Branes. I'm 45 years old and I'm a registered nurse and I work for Baptist Hospital.
Okay, I understand that you are a papillary thyroid carcinoma survivor. Can you tell me how did you discover that you had thyroid cancer?
Back in 2013, I was going to the park with my children and we had a minor accident where another car bumped into us. Right after that, I started having headaches, and that same day, I ended up in the emergency room just to make sure they do a CT scan of my head and make sure everything is okay right after that accident. Um, that's when I discovered that there was something going on with my thyroid. The doctor comes out and asks me if I have any thyroid issues or take any thyroid medication. I said no, I never had any history. I don't take any medications. So he said to follow up with my primary care physician because he sees like a small cyst or mass. He wasn't too sure, and that's what I did.
Prior to you discovering that you had a mass, do you have history in the family of thyroid cancer, goiter, hypothyroidism, or hypothyroidism?
Never had any history. I don't have any family history. There's nothing like that with any type of thyroid cancer or any type of cancer in the family.
Okay. So, were you ever been exposed to high levels of radiation?
I wouldn't say high levels of radiation. All I can recall is that back in when I was 15 years old, I had like a bicycle accident where my face hit the floor, and I ended up with a lot of dental work and some kind of fracture there in the inside of my mouth. And ever since, I always have to every year follow up with the dentist. So of course they take a lot of X-rays. So I don't know, like that's always in my head that that probably has something to do with it.
Okay. So, did you ever, prior to that, did you ever feel any um, hoarseness, difficulty swallowing, tightness, or
Never.
feeling your neck full?
Never
Okay.
had any prior symptoms, never had any side effects, never had any issues swallowing, never, I could never recall palpating anything either because the doctors did tell me that it was so deep that nobody was able, and so if they did an assessment on my neck, nobody was able to discover anything because the mass that I had was really deep.
So, what type of scans did they do or biopsies did they provide?
So after that, after following up with the PCP, I was referred to an endocrinologist, and the endocrinologist sent for more testing, more CTs, more sonograms, MRIs, and at the end, of course, a biopsy. So they did a fine needle biopsy, and the first one that they did, actually, I had about two. And the first one they did, it came back positive for papillary carcinoma. I didn't believe it. I was in shock. I told the doctor that's not possible. My family doesn't have anything. I think I was more in shock than anything, you know. I was a single mom at that time, so it was pretty hard to accept.
So, what stage of thyroid cancer did you have?
I had stage one. It was the beginning of my cancer was what is called encapsulated. So everything was found right on time. When I did the surgery, they removed about 11 lymph nodes, and everything was clear with the lymph nodes, and the cancer was at the beginning of.
So, did you have a partial thyroid removal or a full thyroidectomy?
So I had a couple of options per my endocrinologist and my ENT surgeon that they could have done just the partial, but I didn't think about it twice, and I wanted to do just a total thyroidectomy just because I did my own research, and I didn't want to come back to the operating room with another with if they only did the partial. So I just removed it. I removed it all. After that, I had radiation.
Okay, so after the intervention where they did a lymph node dissection, they did a thyroidectomy. Like after you were done with the surgery, what type of therapies did you take? What did they do after that?
So after the surgery, they did something called I-131 therapy, which is basically a radiation pill. So right after the surgery, I had to wait probably like another 2 months, and I was scheduled already for the radiation pill. So basically what they wanted to do is make sure that all the thyroid cells around my neck were dead, and they just wanted to make sure with the radiation pill that that was going to be the case. So I did it at home. I never went to the hospital for that. I went to the hospital to swallow the pill. Right after that, I drove home, and I stayed home for 2 weeks, and I couldn't get close to anybody, my children or anybody that was at home, not even the pets. I had to be all by myself. I had to make sure that everything that I used, that I flushed, that I cleaned, because by this time my body was radioactive, and the hospital and the nurses and the doctors will call me to check up on me. And of course, before that, I also had to be on a low iodine diet, which was that was the hardest part, I think, because I love to eat. So of course, being on that kind of diet, it was, but you know I'm blessed.
Okay, great. So then after that, so now you have to be on a thyroid hormone therapy for life. So
So yes, I have to be on a medication for life. I take Synthroid every morning, 125 micrograms. It was very hard at the beginning. At the beginning, the first 5 years, it was really hard to match me up with something that I will adjust to it. I know at the beginning they started with the regular genetic levothoraxine. It was still not working. And then they did some other ones I don't recall. It's been a couple of years now, but now I'm taking the Centro, the brand name, and that's the only one that works for me. So far so good, and I do routinely checkups. I have to follow up with the endocrinologist. I have to go to doctor's appointments and lab work like every 6 months, every 3 months sometimes, because they also check for tumor markers for my thyroid, and they also do sonograms yearly just to make sure it doesn't come back. So yes, it's already part of my life.
okay, great. Well, you've been cancer free for how many years already?
Wow, it's been since 2013. It's gonna be like 7 to 8 years. So I feel very blessed, very blessed. I think I was one of the lucky ones, and I feel so blessed. And I think the guy that actually bumped into me was an angel sent by God, because otherwise I would have never find out. Otherwise it would have been years before I find out that I had cancer, and maybe it would have been metastasis already. I would have not been here so blessed and lucky as I am today.
Well, last question, Ms. Brandon. Now with recent studies, they say that thyroid cancer, they're not recommending surgeries. Would you have still done it today if this would have been in occurrence today now, or you would have taken a different route?
I think that because I work in the medical field and that I've been a nurse for so long, I don't take cancer to I don't I take cancer very serious, even if it's minor cancer. I'm very radical. Everybody's different, but myself, for me, for my body, I'm very radical. If they say you have cancer on the left side or the right side, everything's coming off. If they say they found eventually something on one breast, everything for me is coming off. So I don't regret a bit the decisions I have made in the past.
Great. Well, thank you, Ms. Brandis. for sharing this with us. Class, Roxana Branes, papillary thyroid cancer survivor. Thank you.